Hello, my name is Daniyal Liaqat and I'm a postdoc at the University of Toronto. Today I'll be talking about COVID-free at home, which is our solution for monitoring COVID-19 positive patients as they recover at home. This is a project that we're launching with University Health Network and Sunnybrook Health Sciences Center, and we're actively looking for more sites that we could enroll into the study as well. So we're looking at a very specific setting, which is somebody who either began developing symptoms of COVID-19 at home or came into contact with somebody else who had it, and they decide to go to the hospital to get tested. So they get tested, but their symptoms aren't severe enough that they require immediate hospitalization, so they are asked to return home and self-isolate. Later on, their test comes back positive, so now they're COVID-19 positive. And this is the patient that we're interested in. So most of these patients will recover. However, some percentage of them will deteriorate and require hospitalization. So in this setting, there's a few problems that we want to try and address. The first is, how can patients communicate with their doctors? So now that there's a physical distance between the hospital and the patient, patients need a way of telling their care provider what symptoms they're experiencing and how they're doing. On the other side of that, doctors need a way of monitoring all the patients who are under their care. And understandably, many of the patients who are self-isolating at home are worried about their health. So we wanted to find a way to reassure patients who are actually recovering that they're recovering and don't necessarily need to return to the hospital. We also wanted to find a way to help identify those patients who are deteriorating so that they can be brought back to the hospital for the care that they need. Our key idea is to use mobile technology to monitor these patients. By mobile technology, I mean smartwatches, which contain sensors that allow us to passively monitor patients, smartphones that allow us to interact with patients, and then a backend and dashboard that allows clinicians to monitor the data that's coming in and communicate with the patients. So the basic process is, at each site that we have in the study, we have research coordinators who reach out to the patients recruited from that site. So this will be a phone or video call. During this call, they will review the consent form. And if patients consent to the study, then they will be asked to install the mobile application on their phone. Patients will install the mobile application and then start reporting their symptoms, their sensor data, and any non-urgent concerns that they have. At some point, the research coordinator will mail them an oximeter, thermometer, smartwatch, and smartphone, which the patient will also begin using once they receive them. And then continuously, our research coordinators, clinicians, and nurses who are part of the study are monitoring the data that we're receiving and providing feedback to patients where needed. So what we have now is a mobile application that allows patients to report their symptoms. These symptoms are fed into our dashboard, which is used by the clinicians. The next step is to incorporate devices such as a smartwatch and smartphone, which contain sensors such as an IMU, a microphone, and a PPG sensor, which can give us signals such as respiratory rate, physical activity, coughing frequency, speech patterns, and heart rate. So once we have symptoms and signals, the next step would be to build a predictive model to predict who will recover and who will deteriorate. This model will help in identifying those who need to be brought back to the hospital, as well as reassure those who are recovering that they are recovering. With that, I would like to thank all the many collaborators on this project and the audience for listening. Thank you.